So Dr. Nobleza went to medical school in the Philippines and then came to University of Connecticut for neurology residency and did her neurocritical care fellowship at Hopkins. She was at University of Mississippi for several years and recently moved to Tennessee at Baptist Memorial, where she's the medical director of the neurocritical care service. I think one of the things that is pretty amazing about Dr. Nobleza is the amount of work that she has put in towards diversity and inclusion within neurocritical care. She actually won an innovation award at University of Mississippi. She's gotten a presidential citation from the Neurocritical Care Society in 2021. And I can personally say that she has been amazing at getting the names of newer faculty in for all of the more junior people to present at national conferences. And so I think she's really thought quite a bit about inclusion and how to promote underrepresented minorities. And I'm really excited for her to speak to us today about promotion of women in medicine.
Thank you, Dr. Reynolds, for a wonderful introduction. I'm going to talk about promotion of women in medicine beyond the echo chamber. So there's a little twist to what is commonly talked about. And this is something that I've learned or more recently found the importance of in the past year or two. And I'm gonna talk about more about my personal experience on this later on in the talk. So I have no relevant disclosures. So for this talk, I'm going to discuss about the unique challenges that women face when it comes to promotion, but adding that twist of what is the echo chamber and how does that affect promotion of women and how can we step away from that echo chamber, and then give you some strategies that you can apply in your center or in your organization for successful promotion of women in medicine, in neurology, and in neurocritical care. So just briefly, I'm sure we are all familiar with the concept of promotion, but if we have medical students here, in general, in academic medicine, promotion is thought of as an advancement to a higher level rank or position. It comes with that acknowledgement that you were able to demonstrate academic excellence in the missions of the academic center, and you now and you have demonstrated that you have the ability to have greater responsibilities. And it doesn't end with that. Promotion, one of the promotion components is appropriate compensation for that newer responsibility that you're taking in as you move up to your rank. And typically the compensation is based on merit-based or performance evaluation. And different institutions have different algorithms on determining how much they will be a faculty will be compensated for promotion. And if a department or a hospital, if they look at the salaries of other faculty as well, they can base it on that and external market or external competition. And in general, the path to promotion, it varies from institution to institution. And these are the core, some of the core components of promotion. But in general, from a professional development standpoint, we're always, as mid-career or more senior faculty, we're always trying to, we should be trying to think about how we can promote our junior colleagues forward in career development. But from an objective standpoint in academic centers, these are the core, some of the core components of what we call a promotional portfolio. And as you can see, these encompass essentially everything that we do, or most of the things that we do in academic medicine. And I'm saying most because there are things that should be included in a promotional criteria that is still in the works right now with different advocacy groups, in including in an academic promotion committee evaluation. So I just want to briefly go over these things. So if you're applying for a promotion, you usually, as a faculty, will need a nomination by your department chair or your director. You will have to submit your updated CV. You will have to have a teaching portfolio, and that can include any curriculum that you have, lectures, a new you might have evaluation from your residents that you might want to include. So what I did was go to my eValue at that time and just sort of downloaded it as a PDF as part of my teaching portfolio, because they would give feedback on that. And the clinical service is usually based on whatever metric you've discussed. It's commonly an RVU system or a relative value unit system in some centers, or service weeks that you've accomplished. And again, patient feedback that can be part of the clinical service. And then grant support. It can be NIH grant, foundation grants, and then peer-reviewed publication. And take note of that, peer-reviewed publication. So we have now other publications that are non-peer-reviewed, and where does that fit, right? So that's why I'm saying most often than not, they consider peer-reviewed publications. And then impact and relevance to the specific field. So take note of that. How is that measured? So this is one of the things that I'm advocating a lot for, because it is part of the promotion to an associate professor or an associate to professorship. But for junior faculty, you have 6 years to make an impact and to be relevant in your specific field. And usually our first 2 to 3 years is usually just us trying to figure out what we want to do in life as an attending. And then now you're left with 3 years to make an impact and relevance. So this one thing that I saw in my promotions requirement, that I wanted to make sure that I can help others moving forward. And then external or internal letters of recommendation. Again, take note of that, because for you to get external letters of recommendation, some institutions require that you're not personally, you haven't been personally involved with that letter writer. So they couldn't have been your PD in the past, or someone that you had a project with in the past. So based on your reputation or your network, someone should be able to write a letter of recommendation for you. So that's sometimes hard in some of the Facebook groups or networks. I can see some faculty reaching out to strangers just to ask for a letter of recommendations. And then all of these will be now submitted to your promotions committee. So think about these components, because as I describe the various challenges that women face, I will explain how those will impact each of or most of these components. So right now, we are still struggling as women in medicine, because even though we have seen in the recent AAMC report of women applicants in medical school is more than 50%, we can still see that as they go up in ranks, that leaky pipeline starts to be evident, because there's only few departmental chair, and the most common the level of rank that women are the majority are only the instructor level. The rest were not really equal to men. But that's not without saying that it hasn't changed. It has changed, as you can see here on the right side. For in the past 9 years, from 2009 to 2018, there has been some improvement when it comes to the proportion of women faculty achieving as associate professorship, full professorship. But just to take note that the proportion of women, for example, that goes into a division or a section chief position was just increasing approximately 1% per year. So that's still slow, but that's still progress. It was noted also in that AAMC report that the leadership positions that are usually assigned to women are those that are perceived to be communal. So like when you are assigned to a position that you're counseling, talking to faculty, talking to students with issues, DEI, being a DEI officer, but not really the positions that are the endpoint of decision making, like heads of clinical or health affairs. So they noticed that women is not really placed in those positions. And I think from different subspecialties in neurology, we've seen that women are getting less NIH awards, lesser total funding, lower number of grant applications. And when they saw the proportion of women applying, it's less compared to men. So now going into the publications, as I said a while ago, this is one of the components of promotions, and women was found to publish fewer articles. They're less likely to be invited as peer reviewers or part of the editorial board, and less likely to be first or last authors. Some subspecialties are making changes now. More they're having more metrics, more transparency in their editorial board. In some journals, you can see metrics on their website showing what's the proportion of women, what's the proportion of underrepresented minority, and we can also see some editorial board, especially like neurology, they have changed their criteria for the proportion of women in their editorial board. And then when the pandemic hit, the Global Gender Gap Report showed that the women were disproportionately affected by external things outside of work. So on top of the things that we're facing at work, we're also having to manage childcare, housework, elder care on top of that. And then let's talk about gender discrimination. So when we're talking about promotion, we have to consider external factors that might affect how your promotion packet is viewed and seen, and then what are the other factors that may affect your ability to even submit yourself for promotion. And one of those things is discrimination. So this 60,000 physician moms group from Facebook. So this 60,000 mothers who are physicians, right? They answered this survey. They had a 35% response rate from the 16,000 views of the survey, and close to 78% of them admitted to having experienced any discrimination, any form of discrimination at work. And 66% of them felt that they were discriminated because of sex. And then 36% of them felt that they were discriminated because they were mothers, discrimination associated with their maternal duties. And then close to 90% of those mothers felt that they were discriminated because of the other duties and associated associated with breastfeeding. So I wanted to present this data because this will be part of our conversation moving forward when it comes to stepping out of the echo chamber. But I wanted us to be aware of these statistics. And then again, when it comes to teaching, right? Teaching as part of the promotion criteria, we have to be aware that there are biases also against women when it comes to being evaluated by trainees or other learners. And this is just one of the studies, and this is just an example of us just becoming, we just need to be aware that evaluation, sometimes we have to take into consideration other possibilities if you're getting mixed messages with the evaluation, that there might be some biases involved. And for this one, like if you can see, most of the evaluation for the faculty, men physicians had a higher component of higher scores for evaluation, except in the outpatient setting, where women had the higher components of their scores. So all of these contribute to the leaky pipeline for women. And again, this is just to bring that in the forefront. We have a lot of data in medicine, neurology, and neurology when it comes to the leaky pipeline. We're lacking data in neurocritical care. But bringing back, after presenting to you some of the challenges that we're facing, bringing back the path to promotion. So these criteria, you can see how they are interrelated with the challenges that that women can face. So how we try to sort of just put in one visual what one should consider when you are interacting with your women colleague, whether they're junior, mid-career, or senior. There are a lot of factors that they're having to go through that are interrelated, overlapping, and that we're considering all at once. So I needed to show this because later on, when we talk about the echo chamber, we have to be open also as women that we might have a corresponding sort of overlapping issues with our men colleagues too. Maybe they have a similar setup as well, but we don't talk about it that much. But I wanted to present from the women's perspective that this is how we see things. This is how these are the things that we have to deal with, and all of these affect our promotion. So I'm just gonna pause because I'm going to start talking about what the echo chamber is. So what I did first was to present the components of how we can promote women, and specifically in the academic setting, how the promotion process works, and what are the components of that. What are the challenges that women specifically face, and how it affects their promotion process. And so now we're going to talk about the echo chamber. So this is something unique that I've been talking about more because I think this is important for progress. So the echo chamber effect happens when only certain ideas among people that believe the same things go together and talk about the same things all the time. And so they only include a homogeneous group of people. Sometimes if there's one person, there are two people that are not having the same ideas, they eventually get excluded. And this effect, or this phenomenon, have been described mostly in politics and social media, but I think it's applicable with us too in the academic setting. So they've been described as information limiting environments, and I will explain why. The prerequisites of an echo chamber effect, and then remember this, because this will help you identify whether or not you're in an echo chamber. So there is this invisible societal boundary that's created because of being exclusive of only the ideas that are agreed upon by those within the echo chamber. So if you are there seeing the same information, everyone's agreeing, and the leader will say something and everyone's agreeing and no one is saying anything against it, you might be in an echo chamber. And so how does this affect promotion? When we want to get promoted, or when we want our juniors to have progressive professional development, we need to have a more inclusive, more diverse thought process, learning process, network, viewpoints, because they need to grow. We need to grow. And being in an echo chamber, if we don't recognize it, we might not know that our views are limited. And that can be seen on mentorship, may limit your network, and then you eventually will find yourself in a very exclusive group, and then it will be difficult to reach out to other networks because of that. In the echo chamber, because disagreements are not welcome, you might not be used to situations where you're being challenged, like your thoughts are being challenged, and that can affect your professional growth. So just as an example, specifically for mentorship, because mentorship is a big component of professional growth and promotion, I want to make a point that this is one of the studies that were done that shows that gender concordance is not that important, or it does not impact the satisfaction in a mentorship relationship. It is difficult to study this prospectively, but there are several studies that are consistent showing that gender concordance may not be a requirement for a mentorship relationship. So I'm just going to give you two cases to demonstrate the effect of an echo chamber. So these are two real cases. So there's one organization that intended to develop a women exclusive mentorship and sponsorship program. And that was the advertisement, that this is a women only mentorship program. But unfortunately, in a center, right, and historically, and we saw in the statistics, senior women, because they also excluded assistant professors to be mentors. They wanted only associate professors and above to be mentors. We know that there will only be few women available to be mentors. But because there were a lot of juniors and trainees that wanted to be mentees, the ratio and proportion of from mentors to mentees was not sustainable. So they did have the meet and greet to discuss women-specific issues, and eventually there was no real output for that project. No one really was able to sustain meeting continuously because there was no goal created for that initiative. And then another similar initiative that was created was a program wherein they were able to set up the goal of meeting regularly to talk about issues applying to women, okay, excluding men. But as I analyzed what was going on, I realized that I was hearing the same things that I've read about, that I attend a lot of women workshop, and it's the same things. But because the initiative only included women, there was no opportunity for me to understand what are men's thoughts on these kinds of issues, because I want to know too. I discuss it with my husband, and he has a good thoughts about our issues too. And it doesn't mean that it's going to be a man versus woman. And I think that's one of the things that we should start doing. So what's the path forward? So first is we have to recognize what the echo, when we are in an echo chamber, and that includes us being very in tune with what is being talked about, us seeing whether or not is disagreement welcome or not, and then maybe be that person who introduces a new thought. Be intentional. So you have to be intentional in recruitment. If you're a leader in an institution and you're part of the recruitment, maybe have someone who can bring something new and not necessarily someone that thinks the same way as you. This will affect mentor retention too. If you have mentor-mentee groups, be intentional in having diverse candidates in that mentor-mentee pair, mentor-mentee initiatives. And then in terms of sponsorship, so be intentional again. You have to sponsor not only the faculty that think like you, maybe take that as an opportunity to understand what are the thoughts of other faculty or junior faculty or trainees that do not necessarily think like you or do not necessarily do the same project as you, but you still sponsor them and try to help them look for opportunities and introduce them to other people, not necessarily in your own field. Try to recruit people that will add thoughts, initiatives, in projects, not necessarily multiply what you already have, and encourage discussions and dialogues. And one of the things that I found that was recommended was saying yes and not but, because but is sometimes thought of as discouraging and negative. So if someone is trying to say something in a group or in a meeting, or if you want to agree and you want to add something, you say yes and in that meeting. If you're one of the leaders in a meeting and the meeting is going to end and it seems like everyone was saying yes to you, take that initiative to ask for another opinion and try to change that culture that you're welcoming another opinion to start breaking that echo chamber. And then sometimes you really just have to reflect, and that's what I did in the past 1 to 2 years. I reflected on my social media. If I am in an echo chamber and I try to sort of break it, I'm still trying to break it. And then my colleagues, and then just within myself, like I try to evaluate myself whether or not I'm having exclusive opinions, whether or not I'm open to other opinions. And just to give you an example, so as a leader in your institution, being open to other things outside of what is commonly talked about with regards to publication challenges and those kinds of things. If you want to make a change, I encourage men to reach out to mothers. So I'm using this data from the Physician Moms group, where they actually stratify or rank what are the important things for mothers because of their experience of discrimination. And for those who experienced maternal discrimination, longer paid maternity leave was one of the things that was significantly important compared to those who didn't experience maternal discrimination. Backup childcare, more support for breast milk and pumping, and more sick days. Now, in terms of the echo chamber, so I know about this data for women. But for me to step intentionally outside of my echo chamber, I've been asking men also, like, what are your thoughts about paternity leave? I was talking to one of the chairs, a chairwoman in another institution, and she was saying actually she's breaking her own echo chamber too, because she's trying to increase the paternity leave weeks. Because why do mothers have to be the only one at home with 3 months maternity leave? Fathers need, or want, I'm thinking all fathers would want to spend time with their newborn too. And I want to have more conversation about that. I want to know what fathers think about backup childcare. I want to know what they think about how they can support pumping. Um, and again, that's going to be intentional, because it is a hard first step. That's not our culture. And then be intentional in addressing sexual harassment and diversity. It is very awkward. I've seen trainees really be lost when they experience this. They really have no idea where to turn to. I know that we talk about organizations, and this is both men and women, men and women. I know that we talk about rules and organizations, but if the leaders or the senior members of the academic community don't talk about it, we can see women grouping with each other, and then just talking about their issues and not reaching out to, for example, if their chair is a man, if we don't break the echo chamber, it will be hard to bridge that gap of them talking about harassment with their chair if they're not gender concordant. So we have to take a step back on that. And then what is inexorable zero? So this was actually a phenomenon that was described in law, where if you have one, in this example, if you have one woman faculty, for example, that actually signifies something, a symptom of your organization. So do not try to eliminate that phenomenon. And I think there are a lot of movement now, and we can see a lot of active, diverse recruitment from a lot of institutions. And specifically for this, you might want to look at your promotions criteria. Again, do not try not to group with according to gender. Let's break that echo chamber and work together. Let's look at the faculty promotions criteria that and look at the things that apply to both men and women, and see how can we promote each other, help women also, because historically, from the numbers, from the statistics, women need more help in promotions compared to men, but it doesn't mean that men don't need it too. So we have to have that conversation, assess the committees, the committee members, educate. It doesn't mean that you're in a committee that you're not supposed to be listening to webinars if needed. And I just wanted to share for me in the next few slides, because of my experience with the echo chamber, that I personally realized that I might be part of it, and I might have been part of promoting it. I volunteered to join this collaborative study. I know it's called Women in Neurology, but that's how it started. And this is a volunteer non-funded study that we've been doing for 2.5 years. And this started with 5 women who was very passionate about promoting women. And we recruited 19 academic neurology centers to participate in our survey. So what's unique with this survey, though, even though we're called Women in Neurology Collaborative Study, the survey do not only ask the women's opinions. The survey is for all faculty of the academic neurology department, because we want to know what men's thoughts are as well. What are their perception about certain issues. And so this year we've closed the survey and we have 462 respondents, and now I'm going to present some of the results that we have gotten. And these are the domains that we studied, things that are not commonly studied, especially in neurology. So parental leave, we wanted to know how many men actually have parental leave. How do they experience family work conflict? Who is the primary caregiver? We want to know how many are men who identify themselves as a primary caregiver, and I think that's important for academic departments to know, and then the level of burnout. So this is just giving you an example of the data points that we took in for academic achievement, and then this one is for gender perception of gender disparity. So we wanted to analyze what is the perception of men versus women in terms of how do they think, is there a gender disparity or not, is it present or not in terms of compensation. And then we looked at BIPOC versus white cohorts as well. So these are, I'm sorry for the font, I don't know what happened, but these are the 19 academic centers that participated. We had an average of 35% respondent response rate. And so, for example, can you see the majority of the respondents are women, but you can see that there are about 198 men responded in the survey. So that was, we were happy to see that. And you can see majority of the respondents are married. And most of them are above the majority are assistant professors, but they're associate and professor respondents as well. So just as an example of what you're going to see when we publish our manuscript, we're asking, are you content with your current compensation? And you can see some disparity, like white men, majority of those who said yes were white men, and majority of those who said no were the BIPOC women. And these data points that you're seeing encircled here are things that each of these 19 centers are now going to be able to take to their department. And that's our next steps, just to analyze how they can help the department, how they can help the growth and start the conversation and dialogue to improve their recruitment, the pipeline, and in academic neurology. And this, our survey, and I think our study can be applied to other subspecialties and other centers as well, outside of the 19. So here, my current department has programs to enhance gender equity. There's still a significant proportion that disagreed, even though majority of the women faculty agreed. And then in terms of diversity in leadership positions, so the women, as you can see, are not agreeing when it comes to this disparity. So there's that perception, right, that we might need to look into as within our institutions. In vascular neurology, for example, men, we have a subset of vascular neurology component, and we found there that men were likely to be more satisfied with their compensation compared to women. But in terms of what we knew about the projects, awards, and publications, we know that in neurology that men had more advantage in terms of that, but in the subset of vascular neurology, it wasn't significant. So our next steps when we start bringing out our data is to increase dialogue, not only among us, but also with everyone who who want to use our data to improve promotion, diversity in their departments. We want to advocate more for diversity, not only for women, but to just really work together to promote all of us and to remove or to improve the disparity that we're seeing right now. And here we're going to do more outreach, and hopefully our data will improve metrics in different institutions and different programs. So in summary, promoting women doesn't necessarily mean that we have to just work only with women. We have to break our echo chambers so that we can work together with men, understand how our issues overlap, understand how we can help each other, how they can help us. And we should look for ways to reach out and collaborate, because as from my experience, it has only been very helpful, not only for me, but for everyone involved outside of that echo chamber. So just to show you, this is our WINGS advisory group. And Dr. MacArthur has been very helpful, and Dr. Strober, to give us another viewpoint from a men's perspective. And they've taken our study in their advisory boards also, and we've been in discussion with other leaders in neurology as well. And this is my outside the echo chamber. So as you can see, I have mentors and role models that are not just women, and it has been a great experience. Thank you so much, and I'm free to answer any questions.
Thank you so much for that talk. I'm sure people are going to be putting some questions in the chat. I thought while we wait for that, maybe you could talk a little bit about the excuse me, the women in neurocritical care group that has now, the title's been changed since it first started. And I wondered if you could talk a little bit about how that sort of grew and changed over time.
Yes, thank you for that. So the Women in Neurocritical Care group officially was coined that in 2017. And but before that, there were already a group of women in neurocritical care that were thinking of initiatives to increase the diversity of women and to promote women in neurocritical care. And we officially started the name Women in Neurocritical Care in 2017 under Dr. Brophy's leadership, and Dr. Chandos took over in 2019, and that's when there were more junior faculty that got involved, and more projects got started at that time. And that was also because we had a lot of support from not only women leadership, but also men leadership. And actually at that time, the chair, the president of the Neurocritical Care Society in the next 2 years after WINC was created, were men, and they understood. We had a lot of conversation with them about the importance of childcare. That was one of our main initiatives at that year. And that a lot of echo chambers were broken at that time because we wanted to also get husbands involved, the minks. So we had minks, so there's wink and then there's minks, men in neurocritical care, and they were also very positive about the child care initiative. And that's one of the impetus that of when I started thinking about we don't really have to talk about women issues just among women, because minks Minx helped a lot in the board meeting. They did express their thoughts on childcare, and that was the year that we had our first on-site childcare in a neurocritical care society. And then after that, we also created the women speakers list. And when that got created, and with other projects in WINC, the Neurocritical Care Society saw that there might be an opportunity to break that echo chamber of women in neurocritical care and maybe expand to be inclusion in neurocritical care committee, where we are now involving not only women but underrepresented minority, whether you're identifying as a man, woman, or sexual gender minority, and to start thinking of projects to promote not only women but others as well. And that's how WINC transitioned into what we now call as Inc.
If there aren't other questions, I might just have you speak a little bit about some of the initiatives that you had sort of pushed through, because I think that they can be very useful for how we think about kind of lifting up each other as colleagues. If you could give a little bit more information about the speakers list and maybe about the mentorship program as well.
Yeah, so the WINC speakers list was actually how it started was by Dr. Susan Michengel, who just briefly mentioned it in one of the meeting, and it stuck with me. It stuck with me for a year. And when WINC was created, I mentioned to Dr. Chandos, and this is when women promotion is an example of how important it is, because I mentioned it to Dr. Chandos, but I wasn't sure if that was the right thing to do, because it was my first experience in a national organization, and I just wanted to ask her view on that, on creating that. And she was very excited, and she helped me bring that into the forefront of WINC, and help me promote that within WINC. And so far we have 82 women speakers, and what we've been doing is whenever an organization want to diversify their speakership, we send them the speakers list. Most organizations that reach out already have a lot of men representation. It's not that we're being exclusive of men, but they specify needing women speakers, and that's where that WINC speakers list is sent to them. One of the other things that I've helped do with other organizations is to help with their criteria for speakership. So NCS is one of those that didn't have a specific criteria for example, a session, like what is the diversity criteria that you need to have in a session so that you're not excluding other groups. And that's one of the things that the Inc. collaborated on with NCS to have that speakers criteria. So it's a similar process with International Stroke Conference and SECM. So when you see those, when you submit a session, you will see that statement on the diversity criteria. So that's something new that we worked on through Inc. With NCS. In terms of mentorship, in 2019, we piloted the WINC mentorship program. And then we changed that or improved on that to having an Inc. mentorship program, which is now being led by Dr. Morris. And that is a gender non-concordant mentorship, but still having more focus on diverse diverse relationship. And so far, projects have been brought into the neurocritical care society through those mentorship.
Thank you. I think that's, one of the things I noticed as a trainee was that you went to these big conferences and you saw the same people sort of giving the same talks every year. And I think while, it's kind of great to go to a conference and see, one of your heroes give that talk, by the third or fourth time, you're sort of hoping that someone new will come with a fresh perspective. And I think that your list of speakers has really helped to diversify in the most recent years, the speakership within Neurocritical Care Society. So thank you for that.
Oh, thank you.
We are running out of time. I don't know if there are any other questions. Can put them in the Q&A chat. All right, well,